Allergies. These occur when your immune system reacts to a foreign substance that you have either inhaled, ingested, injected, or touched. This episode of the Dr. Bob Show covers springtime allergies, tree pollen, allergy symptoms and causes, and allergy testing and treatments. The host, Dr. Bob Overholt, is a board-certified allergist with the Allergy, Asthma, and Sinus Center in Knoxville, Tennessee. Today's guest is another board-certified allergist, Dr. Karthik Krishnan.
We're talking with Dr. Karthik Krishnan, board-certified allergist, and we're going to be talking about winter and fall allergies. Karthik, welcome to the Dr. Bob Show.
Thank you for having me.
When somebody says fall and winter allergies, what do you think of?
So in the fall, the primary allergen we think about is weed pollen, and the predominant pollen in the fall is ragweed. So a lot of times you'll hear people talk about ragweed season. After the first hard frost, then we start transitioning into the winter allergies. And when we think about winter allergies, we start thinking about indoor allergens such as dust mite, mold, cat, dog, dander, and even food allergies play a role.
It seems like that's pretty confusing to somebody. I don't know what if they've got a cold or they've just got a bummer for a nose? How can we find out if it's really allergy or not? What has to be done?
Right. The only way to know if it's allergies is by allergy testing. And there's two ways to do the testing. There's skin testing and there's blood testing. We prefer to do the skin testing because it's quick and easy.
You can do that while the patient's in the office?
Correct.
Does it take you a couple of days to get the reports?
Nope, you get the results back in 15 minutes.
So when a patient comes in, what are the symptoms that somebody would have with fall allergies? What kind, with ragweed, with weed pollen?
Okay, so we have early symptoms and late symptoms. The early symptoms typically start within minutes of the exposure to up to a couple hours. And what you see is runny nose, sneezing, itching of the nose or itching of the eyes, and ears.
So if somebody's going like this and rubbing their eyes like this, it's a giveaway that they've got allergies.
Right.
Now, in the fall, are we talking about what months for ragweed and other weeds?
So typically we're talking about September and October.
So if somebody starts getting the runny and the itching in September and October, we think of allergies, and you can find out by testing.
Correct.
If it's later on, like October, November, December, fall allergies, then what do you think of?
So then we start transitioning to the indoor allergens, the dust mite and the mold and the pet dander, and things that you're exposed to year round.
Now, you said there was an immediate phase and a late phase to all allergic reactions.
Right.
The immediate phase occurs in the first minutes. Tell me about the late phase reaction. Is that a couple of weeks later?
Okay, so the late phase starts about 4 to 6 hours after the initial exposure.
So if I walk into a ragweed patch, I begin to itch and sneeze, and 3 or 4 hours later, what happens?
So the main symptom is congestion, and that's the symptom that drives people crazy. The reason why, if you can't breathe through your nose, it's going to disrupt your sleep, it's going to interfere with your ability to concentrate. So that's the symptom that bothers people the most.
Is year-round allergies, or is it just winter allergies? If somebody's allergic to dust and mold, does it occur all the time, or it just starts in the winter, or that's part of fall and winter allergies?
So dust and mold, it can be year-round. Dust mite's a major indoor allergen. It's found in anything that's warm and fuzzy, carpeting, upholstered furniture, drapes, beddings. Mold can be found both indoors and outdoors. When it's outdoors, it's really high in the spring, summer, and fall. It almost tracks along with the pollen seasons. But there's also indoor mold, and you can see indoor mold in areas where you have water leakage or water damage. And so those are the primary areas of indoor mold.
So how does the pollen, ragweed pollen, or the mold spores, how do they cause the allergy in the nose?
Okay, so what happens is you inhale the allergen. So what that means is you breathe it in. It can go into your nose, it can get into your eyes, it can get into your lungs. And what happens is it starts an allergic reaction. It binds to a certain antibody called an allergy antibody, that's specific IgE. It binds to certain immune cells, and these cells send signals to the middle of the cell, and they release chemicals. And the common chemical that's released is histamine.
So that's why we take antihistamines. Now, What are some of the antihistamines that we think about when somebody has allergy problems? You put them on an antihistamine. What do you think of?
Right, so we have two generations of antihistamines. We have the first generation antihistamines like Benadryl, chlortrimeton. We have second generation antihistamines like Claritin, Allegra, Zyrtec. Now, the antihistamines are great to control runny nose and sneezing, but they do not help with congestion.
But you said that's the main allergy symptom, somebody that has
Correct.
congestion.
Correct.
So if they're taking Allegra, fexofenadine, Claritin, loratadine, or Zyrtec, cetirizine, the non-sedating antihistamine doesn't help their main problem.
Right.
So what's going on that's causing the congestion, and how do you treat that? What medicines do you use if you can't use antihistamines?
So the single best medicine we have for congestion are nose sprays, and there's two types of nose sprays that we can use. We can use an intranasal antihistamine.
So you can spray an antihistamine on the nose?
Correct.
Does it work just as good as the pill?
It works better than the pill.
How does it work better?
So what it does, it actually blocks inflammatory pathways. These are pathways that cause the swelling in the nose, and so it can block those pathways.
Does it also block the itchy sneezing?
Yes, it will also do that as well.
So it does both the immediate, the runny and itchy nose, and the congestion and the blocked head. It does both of those.
Correct.
What are some of the names of those? What do you call
So
those?
Patanase, azolastine is a generic for Astapro. So those are the three main ones on the market.
And those are topical antihistamines that work
Correct.
both immediate and late phase.
Right.
What other sprays are there?
Okay, so the other class of sprays that we use are intranasal corticosteroids. So that's like Flonase, Nasonex, Nasacort.
Are those dangerous? They're cortisone.
They're safe because they're absorbed locally, and they're very effective.
And how do they work?
Okay, they have the similar action as the intranasal antihistamines. Once again, they block multiple pathways that can cause swelling or inflammation in the nose. And one specific example is that it can block or can eliminate a cell called an eosinophil that's responsible for releasing various inflammatory chemicals.
So can you use a topical antihistamine spray and a topical cortisone spray at the same day, at the same time?
Yes, there's actually one on the market, and it's called Dymista, and it combines fluticasone with azolastine into one medicine.
How effective?
It's very effective. It's actually, you can get, the studies have shown 40% increased symptom control with the combination of the two medicines together.
Better than one of the single ones then you just said?
Correct.
So
Correct.
better than the antihistamine, better than the topical.
Correct.
Dymista has both Flonase and Astelin in it.
Correct.
Or fluticasone and azolastine.
Correct.
Now, when you say sprays, there are other sprays that maybe could cause problems.
Right.
What would
right.
those be?
So a nose spray that causes a lot of problems is a nose spray like Afrin. If you don't use it properly and you stay on it and use it on a regular basis, it can cause permanent swelling in the nose and you stay congested. And if you don't use it on a regular basis, the nose swells up and you can't breathe through your nose.
Are there other treatments available?
Yes, there's allergen immunotherapy.
That's allergy shots?
Correct.
Or even new pills?
Correct.
What is the fall? Well, September, it could be ragweed and weed pollen, September, October. And later on in the fall, when things get a little wetter and a little colder, it could be dust allergy, it could be mold allergy, it could be cat and dog dander allergy, or we haven't even mentioned the possibility of foods yet. So let's talk again about diagnosing the allergy. You diagnose it by skin testing. What's that like?
Okay, so what we do is we can test for tree, grass, weed pollen, cat, dog, dust mite, molds. We can test for foods, and we can even test for certain bee species.
How do you do that?
And what we do is we put drops of those things on a patient's back. We take a plastic toothpick and we gently prick their skin, and we wait 15 minutes and we get a result.
The result, what can you see? The allergic reaction on the back?
Correct. So a positive result will look like a mosquito bite. It'll have a pale raised center, and then it'll have an area of redness around it. And we measure that, and that gives us an idea of the reactivity to that particular allergen.
So the minute you scratch the back, in 15 minutes, you can tell whether that patient's allergic or not.
Correct.
If the back is negative, you may put some little intradermals and wait another 15 minutes.
Correct.
And then you decide on how you're going to treat the patient.
Correct.
They've already used the sprays and the pills. You talked about allergy shots or
Correct.
immunotherapy. Tell me about it.
Okay, so if we've tried avoidance measures and medications and we're still not getting the results we want, and then we talk about allergy shots. Allergy shots are our best long-term option to treat allergies. The reason why, it treats the underlying problem. The immune system is overreacting to these allergens, and so the allergy shots will trick the immune system or alter the immune system to get rid of the allergic reaction.
Is it the only way to get rid of the allergic reaction if somebody has ragweed hay fever symptom in the fall, other than waiting 20 or 30 years?
Yes.
Now the symptoms, if they're helped by medications, do the patients, are they satisfied with pills and sprays, or are they looking for other treatment when they come to see you?
Right. The problem we have with medications is, first of all, you have to take it on a regular basis to get relief. Second of all, it gets costly over time. And then finally, we have good studies to show that compliance rate with medications are pretty poor. So oftentimes patients are looking for another option. They're actually looking for something close to a cure to getting rid of their allergies.
So when they come to you, the symptoms they've got are, again, let's go through those, the nasal symptoms.
Runny nose, sneezing, itchy nose, itchy watery eyes, and most importantly, congestion.
Congestion, stuffy nose,
Correct.
drainage,
Correct.
blocked head. How does that interfere with somebody's quality of life?
So it has a pretty big impact on somebody's quality of life. There's good studies that show that it can interfere with the quality of work as well as performance in school. And people who suffer from allergies that are not well controlled, they'll miss work, they'll miss school, and so it can have a big impact on somebody's life.
Is it a problem as far as snoring goes and maybe even sleep apnea?
Yes, yes.
So people feel poorly, don't perform. How do they do in school if they've got fall allergies? School starting, you want your children to do
Right,
well.
right.
Do allergies keep them from doing well because of these symptoms?
Yes, it can interfere with their school performance.
So they're not doing well. The medicines are not helping. You do the skin testing. You tell them they're allergic to dust or mold or to pollen.
Correct.
And then how do you put somebody on shots? You
Okay.
go to the pharmacist, what do you do?
Okay, so what we do is, based on their skin test results, whatever they were positive to, that's what we're going to put in their vaccine prescription. And so what we do is we create this formulation of the allergens that they're allergic to. And what we do is we give them increasing amounts of things that they're allergic to over time.
So you have to start low.
Correct.
And build up. Do you have to come in? Do you have to get the shot to the doctor's office?
Yes, we prefer that you get them at a medical facility due to concerns of possible reactions. We don't want to put people at increased risk if they're not doing the shots at a medical
So
facility.
how often do you get the shots?
Okay, so the first 4 to 5 months is called the build-up phase, and you can come in anywhere from 1 to 3 times a week at your convenience, depending on what your schedule is. After that build-up phase, then you come in once a week for about 8 months, and then you do every 2 weeks for about a year. Then you can go to every 3 weeks, anywhere from 6 to 12 months. Then you go to once a month, anywhere from 6 to 12 months, and that is a 3-year course, and then we reassess as how far we continue on from there.
Now, every time that patient gets a shot, what's happening to help them?
Okay, so early on what's happening is that the chemical environment is changing. There's a new set of chemicals that are sending suppressor signals to quiet down the allergic reaction. So that occurs early. Later on what happens is that there's an increase in a blocking antibody, and this is called IgG4, and that will continue to rise. As that's rising, there's a decrease in the allergy antibody, that specific IgE. So that's going down, and the neat thing is that it remains down. And this is why we get protection years after you finish a course of allergy shots.
And it may take 3 years to do that. When the allergy antibody level gets way low and the IgG4 protecting antibody gets high, then that patient may be desensitized, not having to take medicines, not having the allergic reaction.
Correct.
Do their stuffy nose and congestion, all that goes away?
Yes.
Can they stop their medicines?
Yes.
How does the patient feel?
They usually feel great. They come back to you and tell you this has been a life-changing experience, and they are able to do the activities they want to do. They're not staying sick all the time. They're able to perform well at work and school, and just overall, they just feel like it was a great benefit for them.
Tell me about the drops and the pills. You don't have to get those at the doctor's office.
Okay.
It sounds like that would be a lot easier.
Right. So there's that form of immunotherapy is called sublingual immunotherapy. We have the drops and we have tablet therapy. Now the drops are very similar to the allergy shots in the sense that they can alter the immune system as well. And it's the same idea. Whatever you're allergic to, we put drops of that under your tongue. And it's a similar 3 to 5 year course, and the outcomes are pretty similar. The downside is that there's good studies to show that compliance with that is pretty poor. Approximately only 18% of the patients who start it actually finish it. So,
and there are tablets to grass. In East Tennessee, where does that present a problem?
Okay, so we're in an interesting location because we have both northern pasture grasses and southern pasture grasses. The grass tablets only have the northern pasture grasses.
So it doesn't really do as much good in this area, maybe. How about ragweed? Do they have tablets for ragweed?
They do.
Can you start taking them during ragweed season?
Typically, you want to start it 3 months before the season starts.
And that should be a hard thing for somebody
Right,
to remember that.
especially when you're not having symptoms that time of year.
Is there anything new in the future other than tablets, sublingual drops, anything in the future that may get rid of allergies where you don't have to do any of this?
Yes, there's some investigational forms of immunotherapy that they're trying. And what they're trying to accomplish is trying to make it more convenient so that we can do it less frequently. So like once a month or once every 3 months. And there's several forms that they're trying out. One is actually injecting the allergen in the lymphatic vessels, which is a little bit different. Another thing that they're trying to do is alter the allergen. They're modifying it, they're adding different things to it to try to alter the immune reaction.
And all the time what you're trying to do is get rid of the IgE allergy and build up the protection.
Correct,
there.
correct.
Karthik Krishnan, you're a wonderful teacher. It's nice to know that there are ways that people can be skin tested, can identify what they're allergic to, and can get rid of their allergies. Thank you for coming.
Great, thank you for having me.
Dr. Bob Overholt is a board-certified allergist practicing medicine in Knoxville, Tennessee. He also hosts a local TV program called The Dr. Bob Show that touches on a wide variety of medical topics, such as the one you've heard today. For more information on Dr. Bob and his involvement in spreading medical education, visit his website at drbobshow.com. Thank you for tuning in. I'm Dasha Tummark. Join us next time to hear Dr. Bob and a guest cover another episode on your health and well-being.